Hello everyone, welcome back to Hands-On Skills. My name's Alex Like, and today we're going to be talking about CPAP. You've probably heard the term CPAP used before. CPAP stands for Continuous Positive Airway Pressure. Originally, CPAP was designed to help people with sleep apnea, but it has wonderful pre-hospital emergency medicine applications as well. It's a non-invasive treatment for acute respiratory conditions, and we'll talk about several of those in the next few slides. Very easy to apply, takes very little training to do so. Very inexpensive to use, not a lot of specialized equipment needed here. We can use this for both adult and pediatric patients if needed. And the nice thing about CPAP is it may prevent the need for some more aggressive airway management or even intubation of the patient if you use it early. CPAP works by increasing the pressure within the lungs using a high pressure continuous airflow. And what we will do is we'll actually hook up a CPAP device directly to an oxygen tank using the DISS port on the side, which bypasses the regulator. In the skills video, you'll see what I mean. When this is applied, you're getting 140 liters per minute of airflow into the patient's face via a mask that they wear. This forces alveoli to remain open. In the cases of certain obstructive illnesses like asthma or bronchoconstriction due to like an allergic trigger, this can actually open up the airways and make respiratory treatments more effective. In patients with pulmonary edema, this will actually force fluid out of the interstitial space between the capillary membranes and the alveolar membranes, improving gas exchange that occurs. But we can use this for a variety of different patients as well. Our COPD patients, CHF patients, patients with pulmonary edema like we talked about, patients with pneumonia, and then patients with asthma. It should be noted, however, that CPAP should not be used or is contraindicated in patients who have the following: patients who cannot follow commands, patients who are unresponsive, patients who lack protective airway reflexes, patients who are in respiratory or cardiac arrest, and this is because CPAP is not a ventilator. CPAP relies on the patient's own respiratory effort to be effective, so your patient has to be able to breathe on their own effectively for CPAP to be useful. Patients who are vomiting, and this is because the high pressure of the mask will cause the patient to aspirate any vomitus should they begin to vomit during the administration of CPAP. Patients who are hypotensive. Now this is very important because what CPAP does as it's forcing high pressure air into your lungs is it's increasing the intrathoracic pressure, which is reducing cardiac preload. So it's filling up your thoracic cavity with air, which in a way compresses the heart and doesn't allow it to pump with the same amount of fluid with each beat. So you have to have a systolic blood pressure of at least 90 millimeters of mercury, and you have to expect some level of blood pressure drop once you start CPAP. Any patients who have an active or have an actual or suspected pneumothorax are not candidates for CPAP, and this is because the air will simply go through the open part of the lung tissue and fill the thoracic cavity, further collapsing the lung, exacerbating or making worse the already existing pneumothorax. Patients who are in cardiogenic shock, for the same reason as hypotension, we're going to reduce preload, thereby further reducing the effectiveness of the heart. Patients who have any penetrating chest trauma, once again, air will simply escape. Patients who have any facial trauma, any anomalies or burns, anything that would prevent us from being able to attach the mask effectively on the patient's face. CPAP relies on a closed system and needs a good seal around the mask to be effective. So anything that's preventing you from getting a good seal on the face, whether that be a congenital defect at birth or through facial trauma, CPAP won't be as effective. Anyone who has a closed head injury, for the same reason as hypotension, because as intracranial pressure increases within the brain, the blood pressure will go up to sort of compensate for that to maintain cerebral perfusion pressure. If we blunt cerebral perfusion pressure by blunting the blood pressure, intracranial pressure, whether it be from like a bleeding lesion within the brain, will increase and will go unhindered, and eventually your brain can become hypoperfused or even anoxic as a result. So you need a more elevated blood pressure to maintain cerebral perfusion in the event that you have an increasing intracranial pressure event. Anyone who has an active GI bleed, and this is because there's a tendency to swallow some of the air that's being blown into you through the CPAP device. And when you fill up the stomach with air, you tend to begin to burp, and then occasionally you'll vomit. And if you're vomiting active GI bleed, they can aspirate this content. Additionally, if they have a GI bleed, the application of air into the gastric tract could reopen already healing wounds. And then anyone who's had recent gastric surgery for the same reason. We don't want to reopen any surgical wounds within the gastric wall or within the stomach. Here's a diagram of a typical CPAP device that you may find in the back of your ambulance. It's very simple, it's very straightforward. As I was talking about in the previous slides, the DISS connection up here is a universal type of airway fitment that will screw into the DISS connector port on your oxygen tank regulator. When you do this, it bypasses the traditional regulator, so you cannot set like a flow rate beyond that point. As soon as you connect this to the tank, by default, it will flow through this setup at 15 liters per minute. And as soon as you screw that in all the way, air, or oxygen rather, will begin flowing into the CPAP device. The next part of the unit here is arguably the most important part. This is the generator, and it has a filter attachment. What this does, the generator will actually suck in room air, atmospheric air, and increase the flow rate by 125 liters to a total of 140 liters per minute by the time it reaches the patient. In doing this though, because you're adding so much room air, you're reducing the FiO2 that came off the tank at 100%. With the addition of this air, you drop the FiO2 to 30%. But that's okay. Multiple studies have shown that an FiO2 of 30% for someone who needs CPAP is the most beneficial setting. On certain CPAP devices, you can actually adjust the FiO2 level between 30, 60, and 90%. But for this particular one, it's fixed at 30%. Attaching the generator to the mask is the expandable ventilator tubing, and this will simply pull out. It's collapsible, and you'll see what I mean here in the video. Also forgot to mention, the filter portion of the generator is a filter designed to filter out most bacterias, molds, and airborne virus particles and droplets, so as not to introduce anything else into a respiratory tract that may already be at risk. On the distal end of your device, if you're going from the tank, is your mask setup with your straps that will attach to the head, and then prior to that is the PEEP valve. In this particular device, the PEEP valve has 3 settings, and the settings are 5 centimeters of water, 7.5 centimeters of water, and 10 centimeters of water. Anatomical PEEP is 5 centimeters of water, and you should begin with this setting. There's also an anti-asphyxia valve in here that will allow the patient to breathe through a port on this side of the device when the airflow isn't flowing from the tank. When airflow flows through the tank, it pushes up a valve here and is directed into the patient's face. When airflow is discontinued from the tank, the valve shuts and allows the patient to breathe air through this vent. Because this mask hooks on very tightly to the face, if this valve wasn't there, the patient could asphyxiate. This is a safety mechanism put in place by the manufacturers. Here's a hands-on video showing the application of CPAP. So to begin, what I'll first do is assure that my patient's ventilatory efforts will actually be improved by the use of CPAP. I'll go ahead and put him on a pulse oximeter and end tidal CO2. Once I've determined that my patient is a good candidate for CPAP and won't need anything more aggressive, I'll begin setting up the mask. This particular device has 3 PEEP settings. I'll set it to 5 to begin. And the orange piece here is what's known as a generator, which takes the flow rate that's going to come off of the DISS port on the tank. The DISS port, which I'm screwing into here, bypasses the regulator and is capable of 15 liters per minute. The orange generator portion of the CPAP will actually increase the flow rate to 140 liters per minute, but drop the FiO2 to 30%. I'll extend the vent tubing, making sure that there are no kinks in it, and that air is flowing normally, and that I have enough length of tubing to reach the patient. As the top straps come pre-connected to the mask, I'll put the mask on the patient's face first, putting those straps up over the head while adjusting the forehead piece. It's helpful to have your partner or the patient hold the mask in place while you adjust the straps. The top set of straps will be velcroed in securely, the bottom straps attached to the side of the mask using clips. Once you have securely affixed these clips, check the tension at each strap to assure that there are no leaks around the outside of the mask. Remember to provide coaching to your patient throughout the entire process of the application of the mask, as this may be a new and overwhelming experience. At this point, I can consider adjusting the PEEP depending on the patient's condition. The default setting of 5 should be used for bronchospasms in pediatric patients, and then the settings of 7.5 or 10 should be used for pneumonia, CHF, or pulmonary edema. Be aware that with some CPAP devices, changing the PEEP settings will increase the oxygen flow through the device, depleting your tank sooner. Alright everyone, thank you for watching that video. I hope you got something out of it. CPAP is a really wonderful device in correcting some of the most fragile airway conditions. You should get familiar with it. You should use it when you need it. You should always consider it an option if you're treating a patient who's on the verge of needing to be intubated. Until next time, continue to stay safe out there. Keep washing your hands. Have a good rest of your night.